Oh, hey, Sharon.
Hey, Caitlin.
Can I ask you a few questions?
Sure.
Awesome. When was Bounce Back founded?
So Bounce Back was founded in 2000 by Stephanie, my wife, and I came in a year later, and we've been going strong ever since.
Nice. How many physical therapists work at Bounce Back?
So we have four physical therapists at the moment. We are just getting ready to bring a new employee in. Her name is Selena. We're really excited to have her. That'll make our fifth PT.
Nice. That's so exciting. How many services does Bounce Back offer?
Oh boy. So we offer traditional physical therapy. We are a physical therapy practice, but we practice a little differently than most. So the services we provide are traditional physical therapy, but above and beyond that, we do laser therapy, we do cupping, we do blood flow restriction training. Very recently, we brought in dry needling, which we're really excited about. That's making a big difference in a lot of our patients' lives. And of course, I always talk about holistic nutritional benefits to eating well and whatnot.
Oh, that's awesome.
Yeah.
What situations or like a time in someone's life would you say it's time to start physical therapy?
Oh boy, that's a question that I get a lot. Oftentimes, by the time you've come in, it may be a little late, but late is never is better than never. Usually, if you're starting to feel a tightness, a stiffness, the beginnings of pain, or inflammation, that's typically a good time to consult with a physical therapist. If we catch it early enough, we can usually stop it in its process pretty quickly. If it's a little bit more advanced, we can still help stop it. It just takes a little bit longer, and the outcome is often very, very good from that standpoint.
Oh, nice. What's a common myth about physical therapy?
Well, there are several. Many people will either think that we do massage like massage therapists do, or they compare us to chiropractors. Um, I have friends that are good chiropractors, and they're wonderful at what we do. But physical therapists is a completely different training. Our medical background is such that we have a pretty comprehensive background with regards to our education. So good, bad, or indifferent, we are different than those two providers, and we are licensed as physical therapists and practice accordingly.
Oh, that's cool. And what would you say is your favorite area of Bounce Back?
Oh boy, if you just kind of pan around, you'll see my favorite part. When you look on that wall, along with all the other walls that are in here, are all about relationships. To me, physical therapy, healthcare providers are all about relationships. The most important thing to me and my staff here is the trust that we establish with our patients, not only the members themselves, but eventually their spouses, their children, their grandparents, their neighbors. It's a community, and that's what it's all about for us.
Oh, that's nice. And what kind of technology and equipment do you guys use in Bounce Back?
Yeah, so alluded to that a little bit earlier. The three tools in the toolbox, I'll say, are cold laser therapy. We use a laser called DioWave. It's a very specific type of laser that's wonderful at treating pain and inflammation, great for fractures and sprains and strains. It's been a game changer for our athletes, also for our adult athletes. We see a lot of adult athletes. So I would say number one is the laser. Number two is blood flow restriction training. So we brought that in several years ago, and basically, without getting into too much detail, it expedites the healing process. If you've had surgery, it accentuates how quickly you can recover, get those muscles to engage. And then lastly, we do cupping and we use a kind of percussion instruments. Most of you know it as Theragun or Hypervolt. We use those technologies to help in healing as well. And then lastly, although it's not a device, the dry needling is a big part of our practice now. And the myth real quickly around that is that that's like acupuncture. It actually is not like acupuncture, and we can certainly talk about that in another question for those people that might be interested in learning the differences between dry needling and acupuncture, because they are not the same thing.
Awesome. How do you assess a patient's needs and create a treatment plan for them?
One word, it's called listen. We listen to our clients. I think we listen better than anybody else that I know of. I think what establishes that relationship, as I had mentioned to you earlier when you looked at those photos, it really is about hearing our clients, understanding their goals, creating a plan of care, and then executing on that plan of care. And it's methodical, it's intentional for a reason. It has served us well for 23 years, and we have thousands of reviews and testimonials that kind of prove that theory. Is that if you listen and you execute, then the outcome is usually really good.
Nice. And what's the most common injury you treat here?
Oh boy, most common injury. I would say, generally speaking, because we see so many adult athletes and we see so many young athletes, I would say they're probably sports injuries, tennis, golf, soccer, lacrosse on the younger side. I think that's kind of our specialty, but we do a ton of spine care, neck issues, back issues after accidents or falls or whatnot. And then lastly, I'm really proud to say that we have a comprehensive balance program. Nate, our other physical therapist, has a specialty in balance and vestibular rehab for people that might have vertigo and whatnot. And so, again, we're very comprehensive. I've always believed that bounce back should be a place that anybody could come to, and we'd be prepared to help anybody that walks in.
Nice. What's the most unique injury you've treated?
um, Early on in my career, I used to work with children that had special needs, children with Down syndrome, children with cerebral palsy. Um, as the years went by, that got a little bit more challenging just because it was so time intensive. I would say, boy, I had a client. I'll never forget him. His name was Brian. He was in a terrible accident. He actually should have died. That's how severe his injuries were. He had fractured hips, fractured back, and I don't have him on the wall. I wish I did. It was probably one of the most miraculous things to happen to any human. He lived. He made a full recovery. I'm proud to say that we were a big part of his recovery, and we stayed friends for a really long time because that's what we do. We spend so much time together.
Aw, that's so nice. If you could describe your patients in 3 words, what would they be?
Ooh, smart. Our patients are very intellectual, demanding. They should be. I think they understand what we provide, and I think they should demand that of us. And that kind of ties into those relationships. And last but not least, they want to be here. They genuinely want to get better. In healthcare, sometimes that's not so easy. Uh, Oftentimes, we'll have clients that want to get better, but it takes effort to do that. And we have clients that really want to do that.
Oh, that's nice. If you could describe bounce back in 3 words, what would they be?
Um, yes, I would say the three words that I use most often with my staff, and I think these are really important, is trustworthy, transparent, and caring. Those would be the three words that I would say define who bounce back is.
Nice. And what's one of your favorite success stories?
Well, I won't use Brian. I'll use somebody else as an example. We had a young athlete several years ago. She was committed to Navy for lacrosse, and she wanted to play her senior year at Conestoga, and ultimately ended up tearing her ACL. It was devastating to her. It was devastating to the family. She had already had a scholarship available to Navy, and unfortunately, she tears that ACL. At the time, Navy said to her, "Hey, we still want you, but we're going to put you into a kind of a secondary school before you come to Navy." And I heard through her parents, her mom particularly, who was a member of Club Maison, that not only did she have a full recovery, but she ended up going on to Navy to have a fantastic career. And I think we were a big part of that process. And again, that's another relationship that we forged many, many years ago. At that time, she was 16, 17 years old. Now she's probably 24 or so.
Oh, nice. What's a movement you would recommend for anyone, no matter what their fitness level is, that they can do every day?
Stretch, 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 stretch. Always make sure that you focus on moving your body. The key to a healthy body is movement. Ultimately, the way that I want all of our clients to treat their bodies is to know that there's only one body and you only get one shot at this. So You want to take care of this body that you have, and you want to do it not only physically, but internally. Watch the foods you eat, take care of yourself, get good sleep, focus on your stress levels, do some meditation, maybe do some yoga. Those are the types of things that keep a body healthy.
Nice. And what would you say sets Bounce Back apart from other practices?
Boy, there are a whole lot of great physical therapists out there. I don't claim to be better than anybody else. I just know that we try harder than anybody else. The relationship is number one for me. Um, More than anything else, when someone walks through that door the way that I did when we first started, the minute you walk through that door, I want you to know that you're being taken care of, not just at the beginning of your journey, not just at the end of your journey, but throughout the entire journey. There are still clients that I hear from that I saw 20 years ago, and that's what it's all about. So better, I'm not sure about that, but we really, really care about the relationships that we have.
Awesome. And then my last question for you, Sharon, is what's something you would want all of the members to know about Bounce Back?
I want you to know that after 23 years of working with thousands and thousands of patients, what matters most to Stephanie and I is making sure that you're able to stay on the journey of your exercise. Because if you're coming to La Maison, you're here to exercise, you're here to take care of yourself. We are another tool in that toolbox to keep those things going, right? So if you come to the gym and you enjoy running and you're on the treadmill and you strain an ankle or you hurt your back, well, that means you have to stop. Well, we can help you get back healthy and get back to doing the things that you love. So, for the members that are out there, if you've had an injury or you're trying to stay on your exercise journey, come in, stop in and see us. We're happy to get you back on that journey. We do it all the time. We've been doing it for years. We'd love the opportunity to do that with you as well.
Awesome. Well, thanks for chatting with me today, Sharon.
Thank you. Bye bye.
Bye.